Good morning, everybody. Thanks for joining me here today. First of all, I want to say again, thank you to Team Manitoba for all you've shown through this unprecedented time, for your strength, for your empathy, for your courage, for your resilience, for your kindness to one another, for your willingness to step up. Je tiens à remercier l'équipe Manitoba pour tout ce que vous avez montré, pour votre force, votre empathie, votre courage et votre résilience. This year has been a year like no other. COVID-19 has handed us new challenges, and even greater than before. Yet this year has shown Manitoba and Manitobans, in most cases, at their finest. You've made significant personal and professional sacrifices to protect yourselves, your loved ones, your community, and your province. And for that, I say sincerely thank you. Manitobans have a long and a very proud history of stepping up, of facing challenges head-on, and of helping one another, especially in times of need. And this is indeed a time of need for many Manitobans. Les Manitobains et Manitobains ont une longue et fière histoire d'intensifier, de relever les défis de front et de s'entraider, surtout en cas de besoin. At the very beginning of this pandemic, some of you will recall, we launched a program called HelpNextDoorMB. It was an online tool to help connect volunteers with Manitobans, seniors in need of assistance, people who needed help with grocery shopping, shoveling a walkway, picking up a prescription, offering to check in on a loved one, things like that. Since the creation of HelpNextDoorMB, more than 7,000 Manitobans from 176 cities and communities have signed up to help someone in need, and that speaks to the quality of Manitobans, their generosity. The need is still there, and as we approach the winter months, and with many Manitobans doing their part and staying home, this can be a very lonely time for many people. It can be an isolating time for many Manitobans, especially our seniors. And so today, I would ask Manitobans to sign up at HelpNextDoorMB, or take the moment to refresh your profile if you already have, and I thank you for that. This is a time where your help will be needed, and it will be appreciated. And I know Manitobans want to help. I mean, saying that over 7,000 Manitobans signed up gives me the confidence to say that we're going to get through this pandemic together, because we have a willingness to step up and help one another. So today, I'm calling on Team Manitoba, that spirit that we've demonstrated many times in our history, to once again shine, and I'm asking you to step up and help where help is needed. Aujourd'hui, j'invite à nouveau l'équipe Manitoba à briller, à intervenir, à aider là où l'aide est nécessaire. Volunteers are needed, and I'm going to also ask you to consider volunteering for other tasks today. We have 19 test sites and more coming, and I need Manitobans to join with our frontline civil servants and others who are already helping in many, many ways in this pandemic to have their backs, to help folks who are involved in going and getting tested in various ways. For example, at the test sites themselves, and to support screening at health facilities, and to provide other health system supports to assist our frontline workers. HelpNextDoorMB, you can sign up. The service will be launched in the Winnipeg and Prairie Mountain Health regions first, and then there'll be further expansions throughout the province to be considered in the coming weeks. I encourage Manitobans to sign up on HelpNextDoorMB, create a profile, and then you'll be able to select the region of the province where you might like to help and an area of interest you might like to help with. And I should mention that a criminal record check and a vulnerable persons check will be automatically performed to ensure the safety of users. But once approved, the volunteer's contact information will be shared with the respective regional health authority to follow up when a match is identified, when your help can be used. And I am sure that our RHAs around the province will be looking forward to your response to this. Manitobans can visit HelpNextDoorMB CA directly, or they can follow the links on manitoba.ca/COVID-19. Today, I am also pleased to announce the next phase of our comprehensive public engagement strategy that will invite Manitobans to provide their feedback in a variety of ways, including telephone town halls, stakeholder roundtables, and online surveys via Engage MB. From the very beginning of this pandemic, we've endeavored to reach out directly to Manitobans, and we've asked Manitobans for their input and advice. We've asked them for their feedback, too, on a variety of measures. As you know, we've used an approach where we announce each of our phases and our plans, usually later in the week, and then invite feedback from Manitobans for a few days, and then we enshrine the changes, just as we did yesterday morning at 12:01 with the necessary tightening of restrictions. We announced those on Friday, instituted them on Monday. And we've taken this approach because we appreciate feedback, and we've invited feedback from Manitobans on many occasions, as you know, and I thank those who've participated and given their feedback to us. More than 100,000 people participated in a series of telephone town halls over the summer months, and approximately 30,000 parents, for example, provided feedback on the education survey that we did as well, to help shape how the province brought children and youth back to school. Fingers crossed, relatively safely so far. Just yesterday we announced that we'd be seeking input on a COVID curfew. This curfew is an idea that we want your feedback on. This would restrict travel between key hours where gathering sizes are in excess of the rules. And the idea here is to try to keep our contact numbers down, and especially those gatherings where we're seeing hotspots, as Dr. Rusin has observed and as other health officials around the world are observing. This gathering issue is a big deal. We want to halt the number of rising cases. As I said yesterday, put a fence around the top of the hill, not just an ambulance at the bottom. And so the community transmission issue is a big issue, and in the Winnipeg metro region especially. Now that survey is now live, and I can tell you, I just came from a meeting with health officials, and I was told as we were lifting the meeting that just during the meeting over 500 people went on and gave us their feedback in just a little more than half an hour. So that's pretty incredible. 3,000 Manitobans gave us their input overnight. And again, I'm encouraging Manitobans to give us their feedback on this potential measure. We'll make our recommendations on it a little later in the week, but we want to hear from you about that, how you feel about it. As well, as part of our public engagement strategy, our government will host a weekly town hall, telephone town hall, and a report from the previous week's town hall will be shared with Manitobans. So this week we're going to be asking you for your perspectives this Thursday, November 5th, on this enforcement issue. This week's theme is enforcement of COVID public health and emergency orders, and the topics will include your views on the COVID curfew in the Winnipeg metro region, how it could be enforced, and a question and answer portal will be available to you on Manitoba's pandemic response system as well. Manitobans can register to participate in Thursday's telephone town hall at engagemb.ca. Now, some of you are saying, I've heard these comments, you know, we just go ahead and do all these things, but the fact of the matter is, this is a societal challenge that is best addressed by having people buy into the proposals that we make. No amount of government planning or government insistence is going to, and we've proven that. My stern daddy appeals to you to follow the rules have not fallen on deaf ears entirely, I hope, but for some people they just don't seem to get the message. But the more people that do, and the more people that have a chance to participate in the design of our programs, I feel the better possibility that they'll work. And so we're trying to do here in this unprecedented time is design programs that have your support and your buy-in, because that's the only way that we're going to be able to arrest this pandemic curve. So Manitobans can register to participate Thursday. If you would like, go to engagemb.ca. And we're also launching a series of targeted virtual stakeholder roundtable discussions to help gain feedback and input for Manitoba's path forward in the fight against this pandemic. I've said it before, and I will say it again today. This is a marathon. This is not a sprint. And if we keep working together as a team, guided by our values of compassion and courage and foresight, we're going to get through this thing together. I look forward to hearing your feedback as we move forward in this fight against COVID-19. I want to emphasize we need the help of all Manitobans to get the messages out and the message across. When we were abiding by the fundamentals, we were beating COVID. And some of us lost our way, and now COVID is beating us. We need to get back to the fundamentals and flatten our COVID curve, and we need to do that now. Now, I know it's a temptation when times are stressful to look at blame placing and finger pointing. I come from a sports and business background where I've seen people do that. But you learn very quickly when you're in sports that that's not helpful. And blame placing when times are tough, just blaming the coach for everything isn't going to help. We have leaders. We have healthcare leaders that are doing their absolute best, and they need your support now when times are challenging. They would appreciate it now, probably more than they would have when things were going really well for us. And I'd ask you to stand behind them and with them as they do their very best at this time. It's crucial we all follow the fundamentals. Stay home when you're sick. Stay home if any member of your family, as Dr. Roussin emphasized yesterday, and Lynette Siragusa did as well. Stay home if any member of your family is sick. Wash your hands. Practice good hygiene. Cover your cough. Physical distancing. Practice physical distancing. Wear a mask. Limit your close contacts by 75%. Please reduce your close contacts. If we can do that over this next few weeks, we got a shot at having a better Christmas. So let's make sure we do that. Get your flu shot and download the COVID Alert app as well. Thank you. I'd be happy to take any questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CJOB, Merrick.
Hey there, Mr. Premier. Manitoba, the Prime Minister said Manitoba received $90,000 of funding for rapid test support for contact tracing and PPE. Just wondering, has Manitoba used those funds, and if so, how so?
We've had 4,500 rapid tests. Most of those, the vast majority of those, were made available in the last 3 days. In the next 3 days, those will be out there. We'll be using those on the front line to assist. Clearly, where we have a nurse, for example, who's got a cough, needs a test. We need it done quickly. We need our frontline people at the front line. That's where they want to be, but they can't be there unless they have this rapid test capacity. So we thank the federal government for beefing up the order. We look forward to receiving additional rapid tests. The testing equipment is important also for folks who live in remote communities, and I know that people like Chief Glenn Hudson up at Peguis, Arlen Dumas, our Indigenous leader, are going to be happy to hear that the feds are going to make those rapid tests available. And I know they'll be happy to know that we're going to make sure that those rapid test materials are available in northern communities, including Indigenous communities, to make sure that folks don't have to wait or travel to Winnipeg in order to get tested. So there would be the prioritization of the rapid testing. I would say also our healthcare people are telling me that they're clearly going to use these where there's an outbreak. So in PCH sites or at St. Vic right now, and that'll assist us. So it's good to have that support. We appreciate it. Of course, the feds centralized the purchase of those, so they blocked our ability to buy additional ones, but they're now making some available, and we thank them for that.
And in terms of the Nextdoor MD initiative, why aren't we hiring workers rather than asking for volunteers?
Well, because most of these tasks that we need here are not highly skilled, permanent civil service needs. They're surge needs. And we have a pandemic right now, and so in the interests of time and in the interests of frankly, taking advantage of the caring nature of Manitobans a bit, we want to access some help quickly. And it's not a time to permanently expand our civil service because of this pandemic. We're all hoping and praying this is a short-term need for surge help. And that surge is there right now, so we're asking for Manitobans' help, and I ask Manitobans to step up as they always do and do the right thing and help us here.
From the Winnipeg Sun, Josh.
Good morning, Mr. Premier. You touched on people asking, well, why aren't we doing this now? The Mayor, Brian Bowman, he basically asked the same thing yesterday. If we're going the public engagement route on this, why was this not done prior to going to Code Red? Why was this as an option? It was potentially on the table, not being looked at when we went to Code Orange as a potential eventuality when it comes to curfews. If this was something even being kicked around back then, why are we doing this now? Because we're delaying in the middle of a spike of cases when this could potentially, if it is on the table, be something that would help lower those contacts.
Well, frankly, Josh, there's always room for backward looking. We're looking forward now. We brought in Red in Winnipeg yesterday, and yesterday I announced the idea on the same day of going to a curfew. It is something that's been done in some other jurisdictions with effect, and so I think it's important when you're restricting people's freedom of movement, as we'll be doing with this, that we make sure we ask the public for their views on this first, and then we'll implement it if the public feels they can support it. But we need public buy-in to make it work. You know, Danny Smythe and his guys have a lot to do. And we're asking for their help in this. Obviously, we'll need the City of Winnipeg Police in particular, RCMP potentially in the capital region to assist us depending on the design of our curfew. And so it needs to be coordinated, needs to be done properly and right, and it needs public buy-in because that's what we want. We want to reduce the number of contacts, and a curfew may well help us to reduce the number of these things like the big house parties that have been happening and things like that that are, according to Dr. Rusin, leading to hotspots and leading to massive, relatively massive uptake in COVID testing as a consequence. We need to address that. We're looking to address it potentially in this way, but we want the public to be engaged first.
And with the program that you're announcing today, looking for volunteers, do you know how many volunteers are required to meet that surge that we are seeing? Is there ballpark on numbers that are required or needed?
Yeah, that's a great question, and it's a moving target, as we can all understand. We have to be willing to adapt and quickly, and so having surge capacity is really useful, Josh. You get this right away. If we can have more people volunteer than we need, that's good. If our COVID numbers continue to go up, we're going to need more. We'll be able to access help quickly. That's a great thing to have, a great position to have. This spring we had over 7,000 people sign up to help, and we didn't need that many people to help. That was great, though, better than the other way around. So again, I'm encouraging Manitobans that can help us with this surge need that we have, and we all hope that this is a short-term thing, and that we don't need everybody, but I'd like to have more than enough help out there to back up our frontline people, to make sure there's additional support there. We have the training for already underway, as you know, at Red River. Great subscription there. Graduated already a number of people to help on actually doing the testing itself, like the nasal swabs. I don't remember the medical term right now, but the nasal swabs. But on a lot of this can be help doing things. I'll give some examples. This could be helping just with respect to directing traffic. Our wait times are coming way down, and that's good, but they could go up. We don't know, and if they go up, we're going to have more of a traffic challenge, so we need help with that. Checking in people, doing the registration. It's not a highly technical job, but it's an important job, and we want to be able to have help there. Screening, initial screening when people come to test sites. Heck, friend of mine went with her kids to and waited for, this was back a couple of weeks ago, waited a couple of hours. with her kids in the car. Just having somebody there that would have given her a bottle or two of water for the kids, that would have been beautiful. So these are the kinds of things we're looking for help with, Josh. And I think also there may be other roles for people to help right in healthcare facilities. Temperature takers might be another example. These are the kinds of tasks we're looking at. I've just given you some examples there.
From CBC Radio Canada, Zoe.
Hello, Mr. Prime Minister. My question today is, you have the impression that the province could have done more to use all the volunteers last time, back in, I don't know, when was that, in April, I guess?
Yeah, Zoe, no, actually what happened there, we asked for volunteers, we got several thousand. Hundreds of them actually were able to give help. And then, as you remember, we hit spring. The numbers started to drop considerably fairly early in the summer. And the snow melted, and people didn't need help with things like as much, like shoveling their walk wasn't an issue, as an example. So the demand went down. But my point would be that the demand can go back up. We got winter coming, and we may well need some additional help out there. And I trust that Manitobans are going to want to step up and help people who need their help. So I'm putting that appeal out now. We all remember, we're Manitobans. We know that things are unpredictable when it comes to the weather. We're adaptable people. We know in this instance, if we have a bunch of snow, we're going to hunker down. Whether there's snow or not, we're going to have to hunker down, to put it mildly. So if our seniors have to hunker down, they may well need, for example, some assistance with picking up some groceries or things like that. When you help in that way, you're helping someone who's higher risk not be put at risk. And it's I think, a beautiful thing for people to do. So I encourage Manitobans to do it.
What will you be doing differently from last time? What have you learned? And I guess you had time to adjust.
Yeah, well, I think you give me the opportunity to emphasize that we've never stopped in our preparation from the very, very beginning. We've been at this full time, all the time. And so, excuse my cough. People have made the observation that we took down our incident command center. And I have to be very, very clear with members of the media and the general public. The incident command center is in place when we were in shutdown, when we were in lockdown in the spring. When we came out of lockdown, we didn't shut down our organization. We had what was called the Provincial Respiratory Virus Steering Committee, much the same membership as the Incident Command Center without the necessity of a lockdown, but still coordinating activities, never stopped working. Co-chairs of that Respiratory Virus Steering Committee, Dr. Brent Rusin, Lynette Siragusa, never stopped, work continued, and so that was going on throughout the summer. Now we're back into red in the city of Winnipeg, command center's back up and running. Assertions made today by someone in the media that emergency measures people haven't been consulted. They've been in every meeting from March till now. So, I guess all I'm asking the media to do is understand that, yeah, we have higher case counts, but the preparatory work, the coordination, the planning has all been underway, and we're bearing criticisms now of not preparing, but the preparation has never stopped. It's been ongoing.
From CBC Manitoba, Bart.
Hello, Mr. Premier, not Mr. Prime Minister, although I appreciate the promotion. If you're genuinely interested in soliciting public opinion about the curfew, why not commission a valid scientific survey with a random sample, free of confirmation bias?
Well, Bart, I think that the way we've been doing it has worked reasonably well. I accept that on some issues, perhaps of more complexity than a curfew, you might want to go to much more detailed and time-consuming processes. But on this one, I'm simply asking Manitobans for their feedback, and I agree with your observation. It might be criticized for being less scientific than some methods, but I think it's an important part of the process to get the public involved and to give the public a chance to have their view heard. Whether they're scientists or not, I think is worthwhile.
Okay, thank you very much for that. Yesterday you mentioned other jurisdictions with curfews. My colleagues have been looking for some in Canada. Can't find any outside of First Nations. Is there another jurisdiction in Canada employing a curfew?
I don't think so, Bart. I could stand to be corrected, as I am quite aware I will be. I believe there have been a variety of curfews or quasi, we'll call them restricted travel rules put in place in several jurisdictions around the world. You know, I have asked Dr. Roussin for his input, as I always do, and he has told me, and I have read, that there are some others. I think regions in Australia have used partial lockdowns or total lockdowns, and that would include travel restrictions in their, my understanding. And I understand, I think, South Korea. You'd have to go outside of Canada, though, Bartley. I accept your observation. I'm not aware of a curfew in Canada. But then again, you know, our numbers are spiking, largely due, not exclusively due, to social gatherings, unprotected social gatherings that are outside of the realms of acceptable. And we need to take action to address those things. And part of that could well be because the predominant number of these apparently happens in later hours to do some type of a curfew. So that's up for discussion. We're looking for input, and I can tell you that we're getting thousands of Manitobans that are giving us their suggestions.
From the Canadian Press, Steve.
Hi, Monsieur le Premier Ministre. That's a term, Prime Minister, that applies in French to both premiers and the Prime Minister, for those wondering. Premier, we continue to get statistics that show that we're skating close to the edge in terms of ICU capacity. And the health officials were on yesterday saying that they had added 3 beds recently in Winnipeg and a few in Brandon, but we're still at 94% capacity. Can you commit to expand the ICU capacity, and do you have a number of in terms of how many beds we might reasonably expect to see in the near future?
Yeah, no, it's a really important issue. It's obviously the most critical. It's the people who are in the most critical danger as well. And ICU planning and that exercise has been tremendously intense and has been underway throughout the summer, and is now going to bear fruit. I am told that by Lynette Siragusa and Dr. Roussin that they're going to be making additional information available in terms of detail, and potentially a briefing to the media later this week or early next on how the structure is going to work. I don't pretend to be a health expert, and I would recommend to the opposition politicians that they also don't try to pretend they are, but I do know enough to know that reducing capacity for doing some of the elective procedures and so on will be part of this plan. That frees up capacity for the intensive care needs that we have. And it is a transitional thing. So it's not a cascade. It's not an immediate shut down all elective surgeries 100% type of deal. But I'll let the experts give you the better briefing than I could possibly give. Suffice to say, I'm confident that the planning work has been done sincerely, and it's been engaged in by all our health experts. All of us are nervous. All of us understandably are stressed. But I would ask that people give, whenever possible, give a pat on the back and the benefit of the doubt to the folks. It's a tendency. I've seen it many times when stressful situations occur in sport. It's not helpful. You know, the guy who always pats Paul Maurice on the back when he's on a 4-game winning streak is the first guy who jumps off and criticizes him when there's 2 losses. I get that. We all understand that. It's human nature. It's not. And I'm seeing some of that right now, and I don't like it. People have genuine reasons to be concerned. Inflating fears with people isn't going to help. It's going to harm. And it is. It is hurting people. I'll have more to say on the mental health supports we've offered in the coming days, but we're going to continue to expand those mental health supports. And this example I'll highlight because we've had great uptake, sadly, from Manitobans who need that support, but their support has been there for them. But I would just urge people to be careful and studious in their observations, make sure they're being fact-based. For example, someone observed, a commentator observed that we shut down all summer. I think it was a political person. They maybe had another agenda. Our testing ramped up over the summer to the point now where we're up over 3,000. We didn't do it in one day, but we did it. And we did it gradually. And it quadrupled over the summer. That doesn't happen unless you're working at it. Our procurement of PPE. Remember in the early days, there were real concerns about shortages of PPE. We have backup PPE now in virtually every category for 6 months, for a year now, with the help of Manitoba small businesses. Since March, we procured 150 ventilators, as an example. That's a big deal. And that tags back, Steve, to your question about the ICU planning. Hundreds of nurses hired, 1,300 nurses hired since last July in Manitoba. This summer, an additional 200 of that number, 277 just this summer, 81 in October. All of this planning, all this work has been ongoing throughout the summer months. So the assertion that work isn't happening is absolutely wrong. PCHs, screening, work, the early rules about single-site staffing that assisted us and that continue to assist us, visitation planning to allow seniors to have a chance to get together with family and with, well, not friends, I guess, because it's limited in number, but to have visitors. All of this planning, all this work has been ongoing. It's never stopped. And so, again, I'm sounding defensive, but I think it's important to understand, for all Manitobans to understand, we've been on this, our senior health people have been on this, we've been working our tails off throughout the entire period since COVID got here, most of us without break, and the fact of the matter is that as much as it's challenging right now, ultimately all this work will pay off if we persevere and if we stick together as a team. That's essential at this time.
Okay, and as a follow-up, I note that there has been some signs of beefed-up enforcement. There were 3 tickets issued in the last couple of days, but 2 licensed establishments that are alleged to have ignored the rules about closing time, serving liquor, allowing people to dance. Are you beefing up enforcement with municipal police, and are you offering municipal police forces a share of the fines to help cover the additional costs?
Yes, and yes. And also, I would emphasize, we also need to get to places outside of the normal realm of where our inspectors go. And we need to go to places they don't normally go at hours that they don't normally go there. In other words, if we're going to shut down loud, raucous parties at 1:30 in the morning, we can't do it between 8:30 and 4:30. And so these steps are underway. More to say on this in the next few days. But I do want anyone who's thinking or advertising to host a big party right now that's going to help spread COVID, I want them to know that we're very, very serious about this, and I need to see these actions taken. They're being pursued as we speak in this building and elsewhere, with planning meetings underway, recruitment underway, approval, Treasury Board approvals underway. All of these steps are being taken. I want Manitobans to know we're very, very serious about the enforcement side. It hasn't been where I want it to be. I've been very clear about that. I'm not throwing anybody under the bus here. Let's be clear. It's my responsibility. I totally accept it. But I think we have to do a better job of sending a message to folks who would break the rules that they're being a danger not only to themselves, more importantly, I guess, to others. And so this is the intention. This is what's going to be happening over the next few days.
From CTV, Jeff.
I'm Mr. Premier, Jeff Keel, CTV. I'm wondering if there is a curfew, how would you deal with the homeless population? Obviously, I looked at the survey today, and it talks about exceptions for essential trips and things like that. How would you deal with the homeless population with a curfew?
That's a great question, Jeff, and these are the details. This is where the consultation helps us so much, as it has in each of our stages, because people raise situations that, frankly, there are many, many considerations here. We have to deal as best as we can with those. You know, what constitutes essential travel? How do you define that? You know, you're coming home from babysitting your daughter's child while your daughter was at work and you're at 12:15. Is that a finable offense? These types of things have to be understood. And I want to make sure that we're not unduly restricting or hurting anybody in their freedom who is responsible and behaving responsibly. Obviously, the goal here is to try to get ahead of the COVID curve and do what we can, in particular on these gatherings and that type of thing. So we want to make sure that we structure this, and you've raised a good example. We want to make sure we structure this thoughtfully, that we're not unduly harming people who mean no harm to us, but that we do have to have some kind of a system I think is becoming increasingly supportable by the evidence.
Thank you for that. My next question is, you're somebody who has always talked against trade barriers, tariffs, things like that. No, it's not common for elected officials to weigh in, but I would like your thoughts on who would you like to see president-elect night?
Quite frankly, Jeff, I'm pretty focused and have been for some 8 months now on an issue that I think matters way more to me and I think matters way more to Manitobans. With all due respect to the Americans, they got their own problems, and boy, they've got them in spades on COVID and on other fronts as well. So I'll let Americans weigh in on this and we'll find out a little more tonight. But I do hope that the outcome is not one that is in dispute. I remember the chaos around the election, Al Gore, George Bush Jr. Election. Many political observers will remember that election and remember the confusion, the dangling chads issue and things like that. We're at a perilous time here in North America. We need leadership to be clear, and the transference of leadership from one president to another cannot be confused and confusing. That will compound our difficulties. So it would be my hope that that is how this is ironed out, hopefully tonight.
From City News, Stephanie.
Hi, Mr. Premier. Stephanie Elsuk from City News. Just looking for a concrete number. How much of the 90,000 from the feds has Manitoba spent already on rapid tests, and how much has been spent elsewhere?
4,500 as of today. That's my update this morning. The rest, the Prime Minister alluded to, is somewhere in the mail, I guess, and we'll look forward to getting it. But we have 4,500.
Okay, and then we're just hearing from business owners who continue to voice their concern about not having enough support to be able to survive in this time. Just wondering, is your government comfortable or happy with the amount of support that they're giving to small businesses in the hospitality industry? Yeah,
there's a false report in the media today, very misleading, which outlined that our programs were somehow surpassed by other provinces. In a couple of categories they are, in terms of the stated number budgeted for the program. But when you get under the surface and do your research, you find out that those programs didn't actually deliver money. Or there was so much red tape involved that people didn't bother applying. When I say our programs are well designed, I mean it. Our programs have got money out the door quickly, without a lot of red tape, to, in the GAP program example, 10,000 small businesses. We've got hundreds of testimonials from people thanking us, and I haven't read a story about anybody in any media outlet that is supportive of these programs. So I'm going to ask the media to consider balance here. We have a wage subsidy program that covers off 50% of wage, up to 20 employees, up to $5,000 per. That's a $100,000 program. Tell me which other province has a program like that, that delivers on the benefits, that actually puts the money out there. We've got tens of millions of dollars going out to our small businesses every week, and I know it's not enough. I come from the small business sector. I understand this. I understand that it's an awful time for our small businesses. But to suggest that we're not stepping up with programs and delivering the money quickly, we are so. And we have been lobbying the federal government on areas where their programs need to step up too. And one of those is on the business overhead side on lease costs and rent costs. And the federal government has said they have a program. I have raised this with the Deputy Prime Minister. I've raised it with the Intergovernmental Affairs Minister. I've raised it with the Prime Minister repeatedly. We cover wages. The federal government covers over the two biggest costs for small businesses are the rent and lease costs and their wage costs. We're on the wage thing. Now, granted, we're not a big help to companies that have 500 employees, and I know that, but we don't have the treasury for that. But we are helping the small businesses tremendously, and we've helped over 20,000 people get their jobs back by partnering with our small business community. So just for once, I'd like some balance and some detail in the investigative work that people are making when they make the assertion our programs are, quote, miserly. They need to do their research. Saskatchewan has been cited as having more generous programs than us. On paper, they have two GAP programs, a $5,000 program, ours is $6,000. Okay, and they announced that early. Ours is $6,000, theirs is $5,000. Sounds to me like ours is bigger. But here's the important thing. Ours has put out twice as much in the way of funds to our small businesses as Saskatchewan's. I'm not knocking Scott Moe here. His program has a lot more requirements in it, a lot more stringency to it than ours. Ours gets the money out the door. So, if you're going to do a comparison, do that comparison. On PPE, our $6,000 GAP program puts $6,000 out there to companies, no strings attached. You can use it for anything you want in your business. Someone said in one of their reports the other day, Ontario has a PPE program. Yes, they do. Its max is $1,000, and it requires a ton of administration, and it will require a lot of bureaucrats to address receipts because it's limited to shields and hand lotion and gloves. Our $6,000 program is at least 6 times as good as that program, and it doesn't require any receipts. So I'm saying to you that we're going to continue to put these programs out there. We're 60% of our budgeted amount now. We don't know how far into COVID we're going to be, and we're prepared to spend more if we need to. But there's a limit to how much the most highly indebted province in the country can do in terms of supports, and we are, by all comparisons, one of the most generous in terms of our budgeted amounts to small business, getting it out the door, getting it out quickly without an abundant amount of red tape. We're going to continue to do that. We've had tens of millions going out every week, and we're going to continue to do that support. So if you want to do comparisons, do them, but get in under the surface and find out how much money is being delivered, not just what's promised in various provinces. You'll find out that Manitoba has the most effective programming to support small businesses, and it's working. So there's my big lecture on that.
From the Winnipeg Free Press, Carol.
Good morning, Premier. You said that the preparations have never stopped and that the Incident Command Center's work was still being done by the Respiratory Virus Steering Committee. So, having said that, Dr. Roussin said back in the spring that we need to expect and prepare for a COVID comeback in the fall, potentially worse than the first wave. If that's the case, then why weren't measures and resources in place to prevent the surge of cases we've seen in personal care homes and hospitals?
Well, your observations are quite fair, Carol. If your observations are based on the incidence of COVID, then you're going to naturally look for reasons why there's a higher incidence of COVID. What I'm arguing here is that we shouldn't draw the false conclusion and look for excuses and blame placing. That isn't productive. It isn't the health leadership of our province that caused COVID to multiply. Their preparatory work on testing was significant, and it's stepped up to multiple levels, as you know, Carol. So we made that commitment to phase up our testing by fall, I said, and we did, and we've exceeded it now. We've had over 4,000 tests done several days. I said the target, and the health officials shared with me early in the year, was to hit 3,000 by fall. We did that, and so testing's ramped up. Apart from the first couple of weeks when the numbers began to spike and testing demand grew, the wait times are now coming down significantly. The online booking, I think, is a big part of that, and that was in the planning stages early on and has been implemented, as you know now. Procurement, that was a major concern early. Our teams pulled together their strategies with the help of, frankly, more than half of our PPE comes from Manitoba companies. Hundreds of Manitoba companies that we coordinated, our officials coordinated with to supply us with PPE. These are just some examples. So I think there's a danger, Carol, frankly, that when we see the COVID numbers go up, we look for somebody to blame, and, well, blame me, that's okay, but don't blame our health officials, because our health officials have been working all summer, as have we, to prepare for this. And yes, we're all surprised at the rapid uptake, part of that in terms of the number of cases. But I would say that part of that may well be that we've relaxed because we were the beneficiaries of our own success early, I guess, in a way. And so now we're shocked to see the numbers go up, as they are in many jurisdictions around the world. That being said, I wouldn't want it said that the preparatory work of our provincial health leaders wasn't being done, and by our elected people too. I know how diligent my ministerial team is, and I know how hard they've been working. And so I'm going to defend our efforts because they have been sincere, real, and consistent throughout the entire time of this COVID pandemic, and they will continue to be. All I can say is it's understandable. Everybody looks for an excuse, a reason, or somebody to blame when things like this happen. But I can tell you our budget for health care this year is $500 million higher than it ever was under the NDP. So it isn't about spending, I don't think. Our reorg of our emergency rooms has actually resulted in us being the only province that's held the line on wait times, actually reduced our wait times when we led the country, when we came into government with longest waits in the country. People remember that. And we've actually effectively reorganized, and we're in the process of investing hundreds of millions of dollars more in reorganizing our emergency rooms so they work. So people don't have to go into an emergency room and get transferred out to another hospital. That was what was going on in Manitoba. So in terms of the budgeted amounts or the allocations of money, we spend more than all but Alberta in the country per capita on health care, and we bolstered our budget for health care by over $1 billion since the COVID pandemic began. So it's not about spending, and it wouldn't be about dedication. Our health care experts are doing their absolute best. Might be other reasons. You'll have to evaluate what some of those causative factors are. But I can tell you one thing. The government didn't invent COVID. The government didn't bring it here. And the government can't stop people from transferring it to each other either. All we can do is our absolute best to react and to prepare to react, and that's what we've done, and also to try to remind, as the media, and thank you to the media for doing this, remind people of their role in this. We're not powerless in this, but we're powerless if we try to blame everybody else, and we don't look at what we ourselves can do. That's why today I'm asking Manitobans if they would mind giving us their feedback. I'd appreciate it, and if they'd mind volunteering, because we're not powerless in this. We were doing great before when we were following the fundamentals, and we can do great again too. And I'm confident in that, and I'm confident in Manitobans. So I'm going to continue to demonstrate that confidence in every decision we take and every decision we make.
From Global, Brittany.
Good afternoon, Premier Brittany from Global News. You say that you're doing the town hall on the curfews because it would be restricting freedom of movement and you really need people's opinion on that. But why hold a town hall when it comes to enforcement that's planned next week when you've already said we're not doing a good enough job?
Yeah, we're stepping up efforts there. Brittany, you've been on this. Others have been on this for a long time. And I have said, and I'll say again, I'm not satisfied with the degree of ticketing and fining that's had to happen. And I base that on the certain knowledge that Dr. Russin has shared with me that some of the leading causes of our new cases are people who are violating the guidelines, in particular on the gathering sizes and so on. So, no, we're not waiting to step up those measures. Some of the detail, though, Brittany, I think is fair, needs to be discussed, and I'd like input on that. The bulk of the input we got, apparently last night, there were 3,000 Manitobans who got on the website and gave us input, and it's I don't know what it is now. It's going up every minute. Is on the curfew itself and ideas around the curfew and penalties. What happens if you violate it and so on. So there's going to be there's going to be a plan. It'll be developed and it'll be implemented based on what Manitobans have advised us on and our experts agree with. That's the marriage we've followed throughout this process.
And as you said, the majority of these issues seem to be happening later at night when there are those large gatherings. The information we've gotten from a number of people is that it's been really difficult to report those. 311 closes after 4:30. It's not open on holidays. The police have already said this is not something that they plan on enforcing. So how are people supposed to be going ahead and reporting when they're seeing these large gatherings and these large events that are happening, after 9 o'clock at night?
That's a great point, and in our many discussions on this and related issues come up that there has to be a better way to get that input from people and react quickly to it. So you hit the nail on the head with the observation. Good people are trying to do the right thing and report in infractions. We've got to make it easier for them to do that. We've got to make sure that there's follow-up then, as much as possible, as much as our resources can allow us to. We've got to follow up and make sure that if people are breaking the rules, there's a consequence. And without that consequence, people are going to continue to break the rules. We need to change that. We need to get all of us need to get on Team Manitoba, and enforcement and penalties around that. Some of these violations are, I think, a big part of how we can turn this flatten this COVID curve.
From the Brandon Sun, our final reporter, Colin.
Hi, Mr. Premier. So after the beginning of the pandemic, when cases started to decline, we reopened, we restarted, and eventually we've had another surge of cases. When we end up peeling back restrictions after the current surge is over, how will the government maybe approach things differently so that we're not in this sort of situation again?
It's a very good question, Colin. I think all of us are learning as we go, and there's bound to be, in hindsight, things that we might have considered doing differently. But I want to clarify one thing, and I want to be very clear on this. Some people are making the assumption that by having Manitobans back to work, that somehow that causes COVID. Don't make that link. That isn't fair. It's not fair to the small businesses or the people who work in them, and it's not fair. There isn't data to support that thesis. We worked very, very hard with our small business leaders. We had calls all throughout, beginning in March, and have continued to have them with over 50 representative groups of workers all around the province to get their opinions and feedback. We developed strategies, protocols, safety mechanisms to help make sure that there was safety there. And when we launched our Ready, Safe, Grow initiative, we combined promotion of back-to-work programs that we were offering, like the wage subsidy program, with promotion of safe practices, like protocols that needed to be followed in various industries and so on. In fact, over 60% of our content and advertising has been focused on the safety piece. But to argue that somehow simply that reopening the economy caused COVID is not a data-supported argument. It's a dangerous assumption. If we have to go further with shutting down the economy, there are, as Dr. Roussin has said, real consequences for Manitobans that are very harmful. And it isn't fair to say, okay, well, let's just shut down the entire economy and close all the businesses, and then we can beat COVID. It's not that simple. It's, in fact, dangerous to work on that supposition. So what we've always tried to do is balance the the arguments for safety, which I make at every press conference. There have been over 70 of them, by the way, and at every one I will emphasize the importance, and I appreciate when it's repeated, and Dr. Roos and Lynette Siragusa do as well, Cameron Friesen does very frequently as well, the importance of the fundamentals to keeping control of COVID. It is a very, very nefarious adversary, and we need to keep mindful that we are not powerless in this. Manitobans, the government doesn't spread COVID, it's spread by people, and sometimes it's done without any ill intent. Honest people transfer COVID, and they don't mean any harm by it. They may be asymptomatic. I don't want to stigmatize people who have got COVID here. That's not what I'm wanting to do. But sometimes people are doing things which allow COVID to populate and spread in the community, and we have to stop that. And the sooner we stop that, the sooner we're going to be saving more lives in this province.
My second question is, I know earlier this year your government received $85.4 million from the federal government for education. Has that money gone out to school divisions yet? And if so, do you know what it's been spent on?
Money represents 2 points. That money represents less than 3% of our education budget. It's less than the $100 million we added to our education budget for Return to Schools initiative that we announced during the summer when some said we weren't working, but we were. And the fact of the matter is that money will be going out over time. And so the education minister will be able to give you detail as to how much has gone out to date. But that money goes into categories where we've already budgeted millions of dollars. And so let's be clear about this. The federal government's money is well appreciated. It represents a little less than 3% of what we've already budgeted for education. And so we won't have any trouble spending the federal government's money along with the taxpayers' money on educational investments. We're one of the leaders in the country on investing in education and training, and we will continue to be. Thanks, everybody.